Good morning, good evening, good night, family caregivers, older persons. Welcome back to Lana's Little Things with me, Dr. Lana, specialist dermatologist, where we talk on all things on living agelessly and ramifications of the aging process, family caregiving, bridging generational gaps, entrepreneurship, and just life itself. But we are in Pinktober, yes. We are still in the month of celebrating, acknowledging, commemorating, remembering, honoring our survivor sisters and increasing awareness in breast cancer. And that's across the spectrum. And as a dermatologist, spoken on several links, several posts, because the myth, there's still a myth that breast cancer will only affect certain women of certain ages at certain times. And you get your things, it'll pass. Many times we all know it's the lump. That's a lump, it'll go away. But what has been increasingly advised, was out of vogue and now in vogue, is your self breast examination. That's what we're going to talk about tonight. So I had to find some medical diagrams and some drawings, my own drawings. We all know the censorship, so just bear with me. I am making it as as lay as simple, easy to understand as possible, so that you can follow. So that from tonight onward, you can do your own breast exam if you haven't yet already done so, and if you have, kudos to you. And again, to my dear friends and survivor sister and survivor family, one day at a time, keep it going, don't give up. No matter what the stage, no matter what your age, always have hope. Always have hope. And just keep your positive thoughts and positive energy going from my heart to yours. So, exactly what is a breast exam? Okay, examining your breasts, just rubbing on them? No. Well, most of them we know that. But what does it really do? Before we talk about how we're going to examine, we talk about what is it really doing. It's been advised from over 40 years now, as far as I can recall. It's an early detection tool, according to the National Breast Cancer Foundation. And I'll leave the links below. And that uses a combination of both physical exam, but also visual examinations. And this might be new to some of you. So just looking and getting familiar with what your normal breast tissue looks like, so that you can tell if there's and pick up if there's any changes. Because bear in mind, you're not a doctor every single day, every 2 weeks, every month. You may not pick up changes. You may never um, pick up changes. Let's hope. But if you do, you're familiar with your breast. You know what your normal breast tissue feels like. You know if it's what we call lumpy. We dealt with dense breast tissue and fatty breast tissue. It gets fatty as you get older because the tissue changes from all the thick ducts preparing for milk for babies. After menopause, those are lessened, and they are replaced by adipose or fat tissue, so they become more fatty, which is why mammograms usually age 40, start from age 40, advisable, unless there's special cases. Okay, so we're going to, the reason why you want to, early detection is your best prevention. You can say that one more time. Early detection is our best prevention. And we can start from there. So know your signs. Get familiar with the breast, as you said. Know what the changes are. So, how often do you do it? How often do you do your breast exam? We're not talking about mammograms tonight. We're just talking about your breast exam. At least once a month. Why once a month? Because breast is not going to change from Mondays to Tuesday. So at least once a month has been advisable. If you, and because for as long as I can remember from being a medical student, it has still remained the same. I remember one famous breast cancer specialist we have here, as she says, her whole life she's detected lumps from patients persons who came into the doctor because they were doing regular examinations and noticed something that was different. Patients, you, me, we are the ones, we women, we ladies are the ones who getting to know our breast pick up our changes. How much more often? Is it 10%, 20%? No, it's 40%. Some places 60%. But so imagine that 4 out of 10 or 6 out of 10 women can actually get early intervention just by knowing what their breast feels like and sensing any changes and going to the doctor right away. Okay, who should be doing this breast exam once a month? Every single lady, person, woman, from the time you reach puberty, when hormones start to be influencing breast tissue and just getting prepared for that new phase in life, from puberty until after menopause. That's basically it. Is that my whole life? Yeah, it's your whole life because if you can find something that can help, you know, treat you early, save your life, give you wonderful years of, even if something happens, a very good chance of therapy and a happy, healthy life, by all means, just do it once a month. So for those who are having their periods, women generally prior to 40, 45, once a month, which would be a few days after your period. Because you know, they're lumpy, they're tender, and you also may not feel any changes when it's that time because the breasts are kind of engorged with the hormones. Makes sense, right? For those who are postmenopausal, pick a day. Pick the first of the month or the middle of the month. No specific reason except that, generally speaking, you can follow the pattern of how your period, how your cycle would have gone. So will you stick to that? Just make it a schedule, make it a habit, whatever works for you. Now, remember, just caveat emptor, buyer beware. Remember, a breast self-examination is never to replace the official exam, the doctor visit, the mammogram, the ultrasound, the MRI, the 3D, the technique, whatever you go to do, it does not replace that, but it does help. You get a better chance in the door to get the exams that will help you to save your life. Remember, you've got a life, full life ahead. You've got family, many of you have children, many of you have parents to take care of. You've got a job that you love. You want to live your life. You want to live it healthy. So, I think I'm just beating that one down to the ground. Okay, so we know when and who and how often. Where? It would be the next question. Hey, so where would you examine your breast? Where can you examine your breast? Most often, doctors would tell you, well, lie flat on your stomach, on your bed, in your bed, on your back, and make sure that the arm that you are examining is on a pillow for ease of access, and then you examine the breast, and then and you also examine under your armpits, and you repeat that on the other side. You also want to be sure never to leave out your armpits. Why? Because in development from fetal stages, from in the womb, breast tissue don't start from the middle, It starts from what you would call under the armpit, so to speak, and then it grows and it comes down into what we would call the breast tissue now, the breast of itself. And that has different stages. So, lying flat on your bed is one way, and you feel in a counterclockwise, and then clockwise, and then you down in the front part by the areola, and then by the nipples. So, here's where my we'll talk about two more places and then we'll show you the diagram. So remember the two physicals and one visual. What's the second visual? Physical in the shower. I've had quite a few patients actually find and discover their lump when they were in the shower. So how do you do that? Well, in this case, instead of your hand behind, kind you raise your arm above you, you're in the shower. So the breast will have a tendency to be lifted. And again, you kind of turn to the side and the breast will be lifted and you lift and you examine around as well. That way, you're less tempted to forget the examination because you're in the shower. So might as well do it in the shower. What's the visual? Well, the visual is because for three reasons. One, you want to see if there's an actual different, there will be different sizes, so don't panic on that. But if you see a significantly bigger breast than the other that you've never seen before, that is not normal for you, please let your doctor know. Secondly, there's something that we call tethering. So cancerous tissue tends to be firmer, tends to be harder. So a pull on the breast. So when you raise your arms up in the front of the mirror, and you may see the nipple or the rest of the breast like pulling on something. What's that? So it may not actually feel like a lump. It might just look like, because you can't feel it, maybe too deep. But it looks as though something is taut underneath my breast. What is that? Just notice that you've never seen it before. Check with your doctor and say, look, I saw this irregularity. It's across the nipple, it's in the breast itself, and it looks like it's pulling on something. Does that make sense? If it does, remember, like, subscribe, share this with a friend. We're losing too many of our ladies every single year. 400,000 women are diagnosed. Every year we lose millions of women to breast cancer. Every year we can just do something about early detection. Because even if we have to intervene, if it's early, we can still do something about it. Just sound passionate because I am, because I've lost so many friends and so many persons going through it, and there, but for the grace of God, go us all. So we need, all of us ladies need to examine. How do you do it? Well, okay, so here is an anatomy of the breast. Just to explain what I said, but this is from the side, a side profile. So again, there's fatty tissue. This is our chest wall. This is fatty tissue and dense tissue, milk ducts going on, and they're all converging toward the nipple. The areola is the darker area around the nipple. That's where the ducts kind of go into, and then you express through the nipple if you're breastfeeding, or if there's an examination for cancer, you see a discharge, then that's a cause of concern, especially if it's not a typical clear or white discharge. If it's bloody or looking odd or it has a scent, something may be wrong. If it's painful, something is also wrong. The misnomer that cancer is painful, that's still a myth. Cancer does not hurt in the breast unless there are unusual things or you got trauma or something. But cancer itself doesn't typically hurt. So don't feel necessary for pain. It's not what you're feeling for. You're feeling to see if there's any abnormality, any lumps and bumps, anything that looks or feels different. Remember I talked about tethering? So you can imagine it's pulling on the wall. And when you lift the breast, it looks as though somebody's like trying to pull it tight. That brings me then, hope you understand this. If there are any questions, please do email me. Please join me on lannaslittlethings.com. Let's just go through this together. Okay. So that's the diagram, the official anatomy of the breast. Now my little drawing, which I cannot do 3D, save my life, but here's what. You can still see it. The breast itself, we saw this one just now. But what I wanted to highlight to you is within what makes the breast fatty, lumpy, and so on. Is because, as I said, all those ducts that we just saw, there's milk, there's normal secretions, and in between there are cancerous, all cells flow through, so cancerous cells will flow through as well. So sometimes if you're really dense, you can feel like what we call lumpy breast. Once it's normal for you, fine. If And then within each lobe is a lobule. So there's several lobules, or several little rounded pieces of tissue, fibrous, dense, fatty tissue that can be in each lobe. So you see why it's important. Does that help with the science of understanding, hey, I'm feeling something and it feels like it's in a line because the ducts all go and converge towards the areola. There we go. Now as you continue, just a few final points on the breast exam. So we know when, we know where, we know why, we know who, we know what you're looking for. Just to emphasize how can you examine your breast? What's the best way to examine? The, we want to do it scientifically. You don't want to miss spaces. So this is why I drew this diagram. You examine your breast in four quadrants of four. So imagine it like a clock face, and you're doing the upper outer quadrant, and you're examining there. Then you come into the lower outer quadrant, that's what it's called, and you examine there. You're all going to, these quadrants are kind of like outside of the areola and the nipple. You're examining here, the lower, then you examine the upper inner, inside, so upper outer, upper inner, lower outer, lower inner, lower inner, lower inner. Get that? In each of those sectors, you may feel a lump. So no lumps don't just move around. Well, some do depending on the period. We're talking about cancerous lumps, which tend to not move. They are making their way. They are growing on healthy cells, and they are latching on. So cancerous cells aren't cells that would move when you touch them and they roll over. No, they stay firm. So then if you can tell your doctor, well, I felt it on the outside on the upper, you don't have to say exactly where or what or how and describe it and everything. But the doctor then gets an idea of where to look. So, summary. Breast exam is vital. Early detection saves lives. How you examine your breast is according to a structure. Who examines their breast starts from puberty to postmenopausal. If you're 70, 18, or active, you have breast tissue, fatty or not, slim or not, overweight or not, your breasts, you know your breasts better than anybody else. You live with them, they live with you every day. So at least once a month, examine, pick a specific day for ladies who are still going through their cycles. Examine on a few days after the period has finished. I trust this was helpful from my heart to yours. We are in this hashtag breast cancer, hashtag cure. We're all looking for a cure, and that while it's on the horizon, while some have had lots of good results, the decision of whatever treatment you decide is up to you. But the examination is starts with you. It starts with you empowering yourself to know your breast the best ever, to know how you can best manage your own situation, and therefore how you can then be your own advocate as well as give the doctor, physician, nurse practitioner the best information possible so that when they examine you, they can then put you on to the next best service, the next best steps. Thank you so much. I trust this was helpful. Please share it with a friend who thinks, oh, that breast exam is out of vogue. No, no, You can still feel and you know what your breasts feel like. From my heart, deepest heart to yours, all the best to you, to all you survivors. Keep going. Prayer, faith, determination, decision making, family support, positive vibes. From my heart to yours, Dr. Lana is signing out for this week on Pinktober. Bye.